share hers.
Okay.
Great, I can see that.
So I will kick it off. Thank you all so much for inviting us today. We're really excited to share more with you about the new hospital. I am Cheryl Gablein-Myers. I am the Associate Vice President of Operations. I have been with CHOP for about 8 years, and I am a longstanding resident of the King of Prussia community. And so I get to sort of see very firsthand the excitement about adding this hospital to these surrounding areas. And I'm here with Emily, who I will hand off to, and she's going to walk us through some more detailed information around services offered, some marketing insights, which we think will be of interest to you all. And but ultimately, we want to open it up for some dialogue. You know, we really hope to walk away from this with a better understanding of the communities that you serve, and how we can better engage with the community and the overall needs of the community as well. So I think, Tessie, you can go to the next slide. I wanted to share this slide because I feel like it's a good demonstration of the sort of breadth of CHOP presence in current state in the Bucks, Montgomery, Delaware, and other surrounding communities, and notably the proximity to Pottstown overall. We have over 50 network locations ranging from primary care to specialty care, to urgent care and surgical care, and local inpatient care partnerships as well with other hospitals. And so this idea of being interdigitated and connected to the community is definitely not a new concept for CHOP. But what is new, the reason we're here today, is that we are, for the very first time, opening a second campus inpatient facility. And we're really excited about the ability to add on to the existing King of Prussia specialty care practice that we have there now. The addition of the hospital really affords CHOP with additional opportunities to strengthen our community partnerships and really ensure that we are showing up for the communities and for our patients and families, and we always like to say in words and in actions. And so we're excited to learn more from you all at the end about how we can deliver on that. A few key points to call out. You know, our Pottstown primary care practice transitioned to CHOP providers in 2012 from a longstanding community-based pediatrician. And this practice in current state supports over 10,000 visits per year. And then recently have added the Collegeville primary care practice in the summer of 2021. We took a few minutes to just look back. We did a 3-year look back of some of the volumes that have hit our Philadelphia campus from an ED and an inpatient perspective. And we looked at that with the lens of surrounding Pottstown, 10-mile radius surrounding Pottstown zip codes. And it was interesting. There have been approximately 2,800 ED encounters within that 10-mile radius at our Philadelphia emergency department. And that's at 2,800 is a combination of the ED and inpatient admissions from patients with a home address in that 10-mile radius. And so, you know, we think that's important to look at because we do believe a large portion of those patients and families could be better served in a community hospital, the CHOP King of Prussia campus, a little closer to home. And so I think it's important to call those pieces out. Next slide, please. So this is sort of the visual demonstration of the King of Prussia Hospital. If you drive by, you will see that it looks like this now. We are pretty close to completion of the construction. The exterior is nearly fully completed with just some of the final touches in landscaping. And then on the inside, we're working through final pieces of building construction as well. You can see the adjacency here to the already existing specialty care and urgent care center that we have. And these buildings are fully connected. And we're working on what we call the One KOP campus philosophy, which is how do we deliver care to patients and families in a very seamless way across emergency, inpatient, outpatient, surgical, urgent care, radiology, and rehabilitative services. And so we like to emphasize the One KOP campus feel because we want this to be a seamless experience for our patients and families, regardless of which side of the building that they are on. Next slide, please. So I'm going to walk us through sort of a narrated, we call it the animated fly-through video. It's a virtual tour, if you will, of the new hospital. And I am going to do my best to keep up with the speed of the fly-through. So Tessie, I am ready whenever you are. Yeah, I'll take it back. So our virtual tour here. And the first image you will see is the front facade of the building and what our patients and families will see as they are approaching the campus from North Gulf Road. To the right, you see the already existing specialty care and ambulatory surgical center. And then in the middle, where these two buildings connect, we call this the beacon. It represents an open, light-filled family connection space across each of the floors. Here we're entering the central welcome lobby for all hospital and specialty care patients. They will be greeted at this welcome desk with concierge-like services by our family and visitor services staff and directed to their destination. Just past this welcome desk, you see the lobby seating space and the admission center just off to the right. We're going to fly into the cafeteria here, which will service patients, families, employees across the entire campus. This is sort of a centralized point of community connection for our families and employees, welcoming guests with the bright and engaging graphics that you see throughout the entire hospital. The cafeteria and patient dining services support a wide range of nutritional needs for patients, visitors, and employees. Moving past the cafeteria here, you will see the coffee shop off to the left. We think it'll be a very busy coffee shop, and one of our two prayer and reflection rooms that are planned for this floor. Also on this floor, you will find the administrative suite, which will house all of the executive team as well as other leaders and key support roles for the hospital. And there's also a CHOP Commons, which is a touchdown space to allow for our Philadelphia campus colleagues to visit and join us here at the King of Prussia campus in a very easy way. And now we are around the rear of the building. This is the south side. You will find the ambulance bays in the emergency department entrance for patients and families. And just to the left of the emergency department is the urgent care. It's a newly relocated and expanded urgent care practice for the SCC side. As we enter the emergency department doors, you see the welcome and registration desk to the right, as well as colorful family waiting area to the left. Looking out over the emergency department, we have our security desk along with our central campus command for security operations, just ensuring that all families and employees are safe in our care on this campus. And now you're going to get a glimpse of the emergency department patient rooms. You will see the continued colorful imagery carried throughout the space. Radiology services are also located adjacent to the ED, offering seamless and efficient transportation of patients for necessary testing such as CAT scan, X-ray, fluoroscopy, ultrasound. We also have MRI services that are available. These services are in our already existing specialty care side of the campus where we have MRI, and we're adding a second MRI in that space as well. The second floor isn't shown in this fly through, but that comprises our 24-bed pediatric intensive care and oncology unit. This is the third floor, which is our perioperative complex. And this is the view looking out over that glass beacon we saw at the beginning of the video. In this perioperative complex, there will be 4 brand new operating rooms added to this campus for day 1. And we have room for growth with 2 additional shell operating rooms that we can build out in the future. This operative complex will service the inpatient needs for surgical services, as well as the already existing ambulatory surgical care services that we are providing in our existing ambulatory surgical services side. And here is the brand new operating room. We're really excited. These operating rooms were thoughtfully designed with a multidisciplinary team across facilities, architects, clinical, and operations. They spent a long time moving parts and pieces around to get the ideal layout to deliver care for the patients. And here we're on a 4th floor, which is our medical surgical unit with another large, bright waiting area for patients and families. There are 28 patient rooms on this floor. Of note, and you will see this in just a second, but all are single patient private rooms. And so there are no shared rooms on this campus. As we enter the unit here, you will see to the right what we call our front desk or collaboration station. This is where folks will be greeted as they enter the unit, and this will serve as a central space for staff to collaborate. Moving down the hall, you see the patient rooms, and as is true across all of the rooms, each room is private, has a dedicated family space for parents and caregivers, allowing our parents to equally disconnect from the clinical nature of the space with their own seating and sleeping area and their own television, which is feedback from our family advisory committee. And here you have one of our playrooms, which are highly utilized at our Philadelphia campus and will be equally utilized at King of Prussia. There have been a number of hands across the entire enterprise that have gone into this design and the construction overall, and we're excited to open this hospital in the near future. I think if we go back to the slide deck, and of course, feel free to enter any questions or thoughts you're having along the way in the chat, and we will work through those as we go. So we will have 52 all private beds opening on day 1. 16 of those will be pediatric intensive care beds and 36 will be medical surgical beds. Our maximum capacity for this site is 108 beds. And so there are 2 shell floors, floors 5 and 6 are sort of waiting while we sort of live the experience of the volumes that we're anticipating for this campus, and we will open them in the future. 4 ORs day 1, shell for 2 additional, and then our emergency department has 20 rooms and shell space for 8 additional rooms. Urgent care is expanded. It's already on this campus, but relocated and expanded with 15 rooms immediately adjacent to the emergency department, and then a comprehensive suite of radiology services, laboratory, pharmacy, etc. I'm going to hand it over to Emily, who's going to give you a little bit more information around some of the services provided, and then some of our marketing insights and vision for the hospital overall. Emily?
Yeah, thanks, Cheryl. I echo Cheryl in saying thank you so much for inviting us this afternoon. It's really important for us to be able to connect with you all, and excited to have some space at the end to hear from you. You can go to the next slide. So CHOP King of Prussia will have over 400 staff members of various disciplines working together to best take care of patients. Out of the clinical component, which is about 60%, we are going to have all of these services that you see here to the right. We will have pediatric emergency medicine, pediatric critical care, and hospital medicine attending physicians in the hospital caring for patients 24/7. These attendings will be working in close collaboration with many advanced practice providers, nurse practitioners, and physician's assistant, which is my role, managing those teams and also taking care of patients myself in the emergency department. This will be a multidisciplinary team composed of nurses, respiratory therapists, PT, OT, speech, registered dietitians, and more. CHOP King of Prussia will also provide case management services, social work, and child life to support children and families during their hospital experience. We will have many subspecialty teams partnering in the care of patients with us, such as neurology, endocrinology, GI, and also many more throughout both campuses, as well as surgical services from urology, orthopedics, general surgery, ENT, and plastic surgery as well. We will be able to care for patients seeking behavioral health care, whether it's an evaluation in the emergency department or a consultation while with us in the hospital through our psychiatry providers and social work providers as well. Okay, you can go to the next slide. Thanks. So our new CHOP King of Prussia Hospital website is live and accessible to the community in order to learn more about the hospital and the services and programs that are included. So this is the website right up here. It also contains a link to the fly-through video that you just saw that Cheryl narrated, as well as some more pictures about the hospital design. So feel free to peruse that and share that with your community. You can go to the next slide. So this slide I find very exciting. I was part of hearing a lot about this marketing research. So CHOP conducted an in-depth kind of marketing analysis to assess what referring providers and especially families are looking for from CHOP King of Prussia Hospital. They held 11 focus groups with parents, and part of those parents were from the Pottstown area. The families expressed that CHOP is a place where they expect and have experienced excellent care and expect that excellent care from King of Prussia as well. The other main theme that emerged was the ease of navigation and ease of access close to their home. So these kind of two emerging themes shaped our hospital value propositions of ease and excellence for our community. You can go to the next slide. So this is kind of like our all-encompassing CHOP King of Prussia Hospital vision slide. This is kind of the things that we live by. And you can see up at the top those values of ease of navigation and excellent care kind of guide us throughout. So we're committing that CHOP King of Prussia will feel like a community, welcoming, caring, collaborative, and engaging. And these are some of the ways that we'll do this: delivering the best clinical care that's expected by patients and families, a culture of innovation, curiosity, efficiency, and transparency, a team model with fluid operational mindset, and constantly working to create systems, processes, and environments for staff to do their best work every day. At the bottom, you'll kind of see our guiding principles throughout the enterprise, our I care values, which are integrity, compassion, accountability, respect, and excellence. Right, go to the next slide, please. So these are sort of our upcoming milestones. As Cheryl alluded to, the hospital is almost complete. It has been very satisfying and exciting to watch every week as the development grows and grows and the building gets nearer to completion, especially the inside hospital design. And I'm sure some of you have driven by or been able to kind of see that for yourselves. So we are so close to completion. We are continuing as King of Prussia teams and leadership to build operational and activation planning to prepare for hospital opening, which is really exciting. And then that kind of brings us to what else we're here for, which is to continue our focus on building partnerships within the community and to hear some of the things that you all need from us and are hoping to see from King of Prussia partnership in the Pottstown and surrounding areas. So you can go to the next slide. So these are some of the topics that we are hoping to hear from you and anything else that you're interested in learning about. So what are the key community needs of the Pottstown and surrounding area? How can CHOP, King of Prussia, better serve that community overall? And then what do you think that we kind of need to get right as we open this new hospital? But opening discussion for anything that you want to ask or share or give us feedback on, please. Thanks.
I have a couple questions.
Hi, I'm Lori Tobias. I can go first. I'm the ED director at Pottstown. How are you?
Hi, good, thank you.
I think one of the big challenges I've noticed with pediatrics and adolescents post-COVID is mental health. So we've seen a huge spike in mental health issues in the emergency department, and it's seen a greater number of children coming to the ER seeking mental health services. So it would be nice, I think for us, that would be a nice thing to have and a nice resource if we, I'm not sure what the plans are, if there is any mental health at King of Prussia, but that is definitely one of the things we're lacking right now.
Absolutely. We agree. And we see this exact same things here at the Philadelphia campus. So we will have a psychiatrist available, as well as a team of advanced practice providers trained in mental health care, as well as social work. So we have kind of a comprehensive behavioral health team available for children that walk into the emergency department and need that evaluation. We have specific rooms that are designed and safe for patients with behavioral health care needs. We have 2 of them in the emergency department. And then we have 4 inpatient beds for children that need to stay to await disposition to either inpatient psychiatric care or kind of whatever medical needs that they may have during that time. And we are very used to using the resources that we have to support those patients with additional kind of ability to expand for whatever they need.
No, Lori, I thought that was a great question. You stole my question, but you were there first. I would expect nothing less. Anyway, but I would like to follow up, regarding mental health, because, certainly whether it's regional, whether it's nationally, whether it's in the Tri-County area, we're seeing capacity concerns related to mental health care, behavioral health care. And so you've talked about the services you might have, but what kind of a waiting time might there be until services could be received? Is your organization taking a longer-term interest in educating professionals with behavioral health degrees? Because I think we're coming out of COVID, you're seeing certainly a vast demand in behavioral health and not enough supply on the professional side to fulfill that. And so try to get some sense for, if Lori or some of the groups that we would work with, the Health and Wellness Foundation, if somebody needs some care, what's the expected length of time until that could be received? And I think also, certainly the Tri-County area is a sub-market for you, but I think there's a need to be able to have a relationship, with not only the Pottstown Emergency Room, but also behavioral health providers in our region. And do you have the capacity? Do you understand what's here, so that there could be a seamless sense of services, so that there's a mix of people receiving services in their backyard, but also realizing maybe under certain very complex medical situations that CHOP could have some answers. And I'm trying to understand pipeline for personnel. And number 2 would be, how does one create a seamless sense of services in partnership?
Great. Yeah, and I think Cheryl and I can absolutely answer this together, because we share in all of those thoughts. So the social work team and the behavioral health team has been doing a lot of community outreach to understand what's available in the community, yours and then elsewhere around the King of Prussia area, to be able to make exactly what you said, those connections, and get them the resources that they need. Understanding insurance, kind of the county services and all of that. And I have seen how hard they've been working to make sure that we have those connections built and we're ready for that. We have had to get creative when you talk about kind of caring for patients that are staying longer than we anticipated and figuring out how can we meet them where we are. I was part of kind of the observation unit where we had almost 14 patients staying for a while with us, waiting for inpatient psychiatric placement. And we have done a lot of amazing things to meet them where they are. Starting care in that setting, starting low dose medications, starting some actual therapy with psychiatrist teams, and also doing some training of staffing to better understand how to de-escalate, how to respond to crises, and how to kind of meet these families and patients where they are, which I think we've really risen to the occasion. And I hope to be able to do the same kind of things at King of Prussia. Go ahead, Cheryl, if you have something to add.
Yeah, so the only thing I would add is just from the more enterprise lens, right? We recognize that King of Prussia Hospital is not going to solve the issues that we're all facing around behavioral health in the community. And, we want to be part of that solution. But I think from an enterprise standpoint, it's important to call out the CHOP commitment, if you will, to creating space and creating the teams that you're describing to help be part of this solution in the long run. And so we're making some investments in partnership with Penn to bring a higher degree of psychiatric care services into the Philadelphia region, but that too will stretch into the King of Prussia and surrounding communities as well. And so it's not the short-term strategy, and it's certainly, these are not the pieces that will be in place for KOP opening on day one, but I think we all feel, and Emily can attest to this too, we all feel that, CHOP is certainly entering the space in a much more intentional way. We're not, and even at our Philadelphia campus, we're not a pediatric psychiatric inpatient facility. And, that sort of creates problems and challenges for us overall, and for most importantly for our patients and families. And so we have the full commitment from a KOP lens to get the patients to the best place of care and to provide them the very best care as we are working through that placement opportunity.
And thanks for managing our expectations. That certainly you're opening up, but we're taking a long-term view here.
Mm-hmm.
And so again, behavioral health, you have to take a long-term view on many different levels of care.
Yes.
And we're trying to make sure that their care could be seamless and that there's a ready link back to this TriCounty area. And very frankly, as we look at perhaps stepping into a post-COVID area, we're seeing an area that continues to grow the number of children that are here. And so this is not a short-term COVID-related issue, but more as people are now moving to the exurbs. And I think people are more likely to receive care in their own backyard for certain levels of behavioral care that might be follow-up to a CHOP visit. And so that's where I think we may need to dive deeper at some future point.
Yeah, absolutely.
I have more questions, but I think others should have the option of, or my colleague Aisha Cooper can say chill Crable. I have at some point, I'd like others to go first. So
I did see the question in the chat. We do not have an MBU unit at the King of Prussia Hospital. Obviously, we have really strong collaboration with our Philadelphia campus. And if it is determined that a given patient who presents to King of Prussia meets the need for MBU level services, we have seamless connectivity to get them to the right level of care and the right location of care. And that's true beyond behavioral health. That's just true across the board. It's important finding in our marketing research that, initially, for those who were aware of the King of Prussia Hospital coming, there was this idea that it would be an exact replica of what we do in a smaller scale, but an exact replica of what we do at Philadelphia campus, which is not true. But we like to really emphasize that, the idea of the patients and families coming to any CHOP door, and we will care for their needs in that moment, and we will get them to the right location of care. And we're fortunate to have a very large enterprise that provides such a comprehensive, approach to care across many different subspecialties. So it just sort of reminds me of, that MBU question sort of triggers for me the idea that, we are part of a large enterprise and we'll get the patients and families where they need to be.
So for the benefit of anyone who might be wrestling with the acronym MBU.
Oh, sorry. Yes. Medical behavioral unit. And so these are actually, Emily, do you want to describe that a little bit more?
Yeah, absolutely. So these are patients with behavioral health care needs or primary diagnosis in that way that are presenting to the hospital with also a medical need. So it might be a child with autism that needs some support services while they're in the hospital, but presenting with kind of like a fever workup or appendicitis, which is a bad example, but something where they have a primary medical need that is the reason for their admission, but they're best served in a place that can handle their behavioral health care needs, and the support is there on that floor. The rooms are all very safe, and the providers are used to caring for kind of both of the needs.
And the reason why I asked that question is because it brings back the question of access, right? There are many children that meet that profile, and I'm kind of wondering how those needs will be met if they present at King of Prussia. Is there a plan to, support those families in a preventative way? I'm just kind of wondering what that looks like. And also in terms of other medical facilities in the area that might need to transfer pediatric patients that present with that profile to your hospital, how that warm handoff can happen.
Yeah, absolutely. And I think it goes a little bit back to what Cheryl described, that we are going to find the absolute best care location for each patient, kind of that fits their needs. We will have a referring line that will be answered by hospitalist medicine attendings that are working at King of Prussia Hospital. And we're really excited about that, but because we feel that allows them to have some discussions about where the best place to bring the patient is. So the family, even though it'll be a seamless kind of one ED visit, it allows the family to have some thought before they present about maybe the place that they want to start, as well as kind of the medical command that will be able to kind of work through that with families depending on their needs. I do think we do have a population of children with neurodiversity and autism spectrum disorder, and I think have the ability to care for many patients kind of locally and take care of them in those places. We definitely have building design that has been kind of sensitive to that. So whether it's acoustics or lighting, so each room has its own lighting, dimming capabilities. They've been very careful to minimize kind of background noises and things like that. We have child life specialists that have specific training to care for patients with these needs, whether it's toys or kind of whatever support services that they need. So I think we will do a really good job managing them as much as possible in the place that they present. Anything to add, Cheryl? There?
No, I think that covers it.
So I had a question just about community needs, in particular underserved communities or communities with not as much by way of resources. In Montgomery County, the two areas that we've all known are areas with concentrations of populations with extra need are Norristown and Pottstown. That's recently been confirmed in the regional healthcare planning work that's going on. Interested in, and we know, certainly CHOP has served communities with greater need in the Philadelphia area and communities closer to the main campus. Can you describe a little bit just the commitment, the mission, the approach to meeting the needs of communities that are traditionally underserved or have needs that go beyond the needs of other communities?
Yeah, I can start with that one, and then I'll welcome Tessie to jump in as well. So we stated, out of the gate that we recognize that that this second campus hospital is not the same community as our Philadelphia campus, and as such, we want to sort of build on the great work that has been done with the Philadelphia and West Philadelphia community at with our existing inpatient site. We would like to replicate that for King of Prussia in a very intentional way. And we're partnering closely with Tessie and Falguni, who are part of our, community relations team overall and community engagement. We have already started to engage with a lot of different avenues, and we have made a stated commitment to first and foremost sort of showing up and meeting the community where they are. So this idea that, you can't serve a community that you don't understand. And so we've already done several leadership volunteer efforts, and we've started sort of with the more immediate surrounding community, Norristown. We did a CHOP specific Keeping Norristown Beautiful event where we went through and, clean the streets and partnered with the community and in that way. We've been volunteering with the Upper Merion Food Bank, and all of these are intentional efforts from a leadership standpoint to say, this matters. And it's an expectation that when you're part of King of Prussia Hospital, you recognize the importance of showing up in words and actions. And we'll start to sort of branch out into different areas. Pottstown is next on our list, and we've been talking through that with Tessie, which is why we were hoping to get ideas from you all today around how we can do that. Tessie, anything to add around like our sort of intentional approach right now for KOPH and in community engagement?
Definitely, and I also welcome Falcone after to pitch in, but just in general, CHOP we have different programs set in place to help internally and externally. So we have employee engagement programs designed to help our employees invest their time, skill, and knowledge in the community through community-based programming, volunteering, etc. And then in terms of external work, we are constantly looking for partnerships in the community, meeting with different organizations, learning about their programs, how they're investing resources into the community, and then how can CHOP collaborate. This is a collaborative effort, so it could be through funding, it could be through sending our employees out there to volunteer, it could be through having some of our employees be guest speakers and talk about topics that their families are interested in. So there's a lot that we already have set. Really, right now we are doing a lot of the outreach efforts, and it just really is about networking, getting to know you, hearing your feedback so that we can kind of go back and create a plan on which organizations should we be communicating with, who should we be working with and collaborating with and supporting, etc. So like Cheryl mentioned, we would really like to hear that feedback. If you are already volunteering in the community, you know of an agency that will really benefit from our collaboration. If you already have and hear needs from your families, let us know what those are. And that way we can see where our employees fit in terms of sharing their skills, their knowledge, their time, and seeing how we can invest our resources and in collaboration. So Falcone, I don't know if there's anything else you would like to add.
Yeah, I think that about sums up our approach. Just to give some examples of some of the things that we're doing, we have a very large care network practice primary care center in Norristown, our second CareAbots center, which if you're familiar with our West Philadelphia CareAbots Pediatrics Care Center, it's a co-located kind of one-stop hub where patients can come in and get not only the medical care that they need, but also the social service programs. So we have a variety of programs in our West Philadelphia center that we want to be able to bring into our new CareAbots Center in Norristown. So currently exploring programs or efforts similar to kind of food distribution or food pantry type of programming, medical legal partnership programming, other social needs services that can be available where parents and families are ready to receive care. We're also supporting various kind of health education efforts. So bringing some of our resources from our Philadelphia campus into our Montgomery County practices as well. So for example, we've done some programming with our concussion care Minds Matter program to provide health education with children and families in that area. We are expanding our Be Well integrative health program into Montgomery County as well to help equip childcare providers with the resources and tools to provide that type of care amongst that setting. And in the Pottstown area, we actually are one of our nurses, our RNs at our care network in Pottstown is leading a menstrual health program to educate and provide resources for menstruating young people who don't normally have the access to those needs that they have as well, and be able to provide that support as well. So there's a variety of things that we're doing and looking to do a lot more. One of the other ways that we are trying to get continued feedback on this is through our community advisory board. We have, I think at this point, 4 representatives on our community advisory board that represent the Montgomery County community as well, so that they can constantly provide us feedback as well. But we welcome that from this group and from anyone else, so that we can continue to stay on top of what community needs are and be able to identify strategies to support in whatever way, providing whatever resources we have available to continue to meet that need.
I guess an observation would be, as you think of marketing and really relating to serving the community, that Montgomery County is about what, 834,000 people last check, right? That is a large and diverse population, from income to achievement to education to work style and working approach. In some respects, it might be helpful to break Montgomery County into smaller sections and realize that certain regions within the county have a natural affinity. And I think that's what we found. If we look at what we would call the TriCounty area, that's about 230,000 people, 3 portions of 3 counties in the western part of what I perceive to be your service area. And so when I hear you say you've got 4 people on from Montgomery County on your advisory board, I'm thinking, well, I'd like to see a whole lot more, or maybe there's a separate advisory board in the west, or maybe there's a CHOP member even on, maybe even on this group. When people like Casey and others, I think, are well informed, yes, you, Casey, among others, who are really informed about this community, Aisha, et cetera. And so, as John was indicating, there are certain areas that have perhaps a greater need, where there might be questions related to health equity, even with the county itself. Very frankly, you put your hospital in the most affluent corner of the county. And there's a great amount of wealth in that area, a great deal of education, but in the West, there are not nearly as many resources. And so I think what I would say is that we have learned how to work together in this region. There are multiple groups on different topics. It could be early education. Aisha Cooper can tell you more. You TriCounty Health Council, the whole group can tell you that. It can be on education. We've got a program officer of the foundation talking about all the schools in the region and what they're about. Or if you're talking about prevention, there's a whole recreation group. The whole region does connect and work together. And so it might be helpful to look at that. We also are data rich. There's a lot of good data, historic data that you can look at, and more needs assessments coming down the pike that will give you some things to maybe look at what I would call a sub-market. And I think if we're all trying to reach the needs of children and provide them better services, be aware that there's a lot here already, and it may have a distinctive flavor that may be different than what you might see in Lower Merion. And so I think being able to respect that and understand that, certainly it would be great. Again, the pie is getting bigger, right? More people are moving here. But again, having a link with what I would call well-established local and regional providers here, I think would be helpful, as you seek to become a friend to the region. So I realize that, Tessie and Falguni, and each of you, Emily, they say, okay, Dave, clone me and I'll do that. Well, maybe we're asking you to be cloned so that we can all come together and best, reach the needs of the people who have the greatest need. So I'll pause there. Aisha, do you have a question on transportation? That was in the group chat.
No, I just, that was more of a statement, a fact, the transportation
Okay.
and for many of the families, especially as those without significant resources, it would be a barrier when you were specifically speaking about the hub at Norristown. So I guess the big question I have in my mind that I'm thinking about, because I have enjoyed getting to know your team in our development of this presentation for the TriCounty Health Council. And I know you have big plans for not only King of Prussia Hospital, but as the community at large, as you've mentioned. So the biggest question I have is what's next in terms of Pottstown? How can TriCounty Health Council be of support and assistance and a collaborative partner? And to Lori's point about the needs at the hospital and wanting to have a good relation in that realm to better service and best serve our families and our community, what can we do to work together and partner to make sure that we meet the needs of families?
I can, maybe I'll answer a question with a question, which is always a fan favorite, but so are there sort of standing forums that you all have? I mean, this is one, I don't know sort of the scale of forums, but where can we immerse ourselves into sort of the you know, the work that you already have underway, right? So this is a learning curve for us to understand the Tri-County area and the different nuances, very specific needs of different populations in Montgomery County. And so I would ask, you know, where can we join you to learn more, to engage more, and to listen for those opportunities to say, hey, we can help with that, or actually we hadn't thought about that. How will we get people, you know, how can we support transportation needs? Because CHOP is a large enterprise. We can rally around different, removing different barriers so that we are reaching these communities. So to answer
I think a great place for you to start is actually on this call. Holly is Executive Director of Tri-County Community Network. They are, and Holly can tell you more about what they do, but their monthly meetings are comprised of 90 nonprofits in the area and they highlight different topics of need. And it's a great way to network with a large number of people at once. So, and that's really the Tri-County area. So that'll extend a little bit towards KOP, but also go into some of the surrounding areas. So that would be a great place. In my recommendation, there are a lot of collaboratives that already meet. There's one on food. There's one established on housing. So these are some of the main kind of heavy hitters in our area and some of the greatest needs that we've identified. But TCM will be able to give you a bridge to some of those meetings that are happening.
That would be so great.
Thanks, Casey.
What were you going to say? I saw you pointing your finger.
I was pointing the finger to this group, to Tri-County Health Council, as something that I think is as a place where the issues, the challenges get discussed, where we work on them, and that feels like an appropriate place for CHOP to plug in, for you all to be able to hear, you know, in a more natural, ongoing way what's going on, what the challenges are, what folks are working on, and be in a position to say, oh, you know, gee, we have this thing that we can do, or we've done this somewhere else. Would that be of interest?
Yeah, absolutely. Thank you for saying that. I would love to find ways for us to continue to partner or just be present to hear. I mean, I should put in transportation. That's something that I've thought a lot about, as in Philadelphia campus, often families do really live in close proximity. And we could get them a cab voucher or some bus tokens to make their way home. But you know, Casey and Lori, if families are being transferred from Pottstown, certainly we want to be able to get them back to their home. One of the other things I was going to mention when we talked about kind of community partnerships, that's kind of a newer one for us, is the, I don't want to butcher this name because it's Mission Kids Child Advocacy Center is what it is. And we have recently partnered with them. And I think I saw their service on your website actually when I was kind of perusing. But we are committed to providing forensic evidence collection and medical examination for sexual assault patients. And I think that I wanted to make sure to share that with Casey and Lori, because we've been partnering with Mission Kids to determine how we can work together, because they offer some things that maybe we can't, and vice versa, and thinking of ways that we can meet that that need. So that was just an example I was going to share. But yeah, I hope to hear more things like that. What other transportation services can we align with and partner with to allow families to come for their care, but then get them back to where they came from?
And we have a pretty large team here. So the collaboratives that you mentioned, we can plug people into those collaboratives who have a passion for that, or their line of work is more directly connected to those different sort of targeted topics. And so we can. It would be great to have an understanding of those different collaboratives and how we can partner.
Great. So I'm just looking at my clock, and you've already made yourselves available for even more time than we thought, and this has been a terrific discussion. Perhaps we should let you all go on to the rest of opening a hospital, which I'm sure is a constant, very, very busy effort. So thank you very much for sharing everything that you shared today, and for the spirit with which you came to the group to listen, and we really appreciate that.
Thank you all so much for the opportunity, and here's to a long-lasting partnership. So thank you.
Thank you as well.
Take care.
Thank you.
Bye-bye.